So let's talk about obesity itself. What is morbid obesity? We've all heard the term morbid obesity. We usually just kind of refer to it as severe obesity nowadays, but it's hard to talk about just weight, because if I say somebody weighs 300 pounds, if they're 7 feet tall, it's not a big deal. If they're 5 feet tall, then there's a significant difference. So what we usually talk in terms of is something called a BMI, or body mass index, and all that is, it's a fancy term for just putting your weight relative to your height. So a BMI of 40 is roughly equivalent to 100 pounds overweight for that given height for that person. Very easy to figure out your BMI. There are many tables. You can just look up your height and weight, or on the website you can just type in your height and weight and it'll tell you what your BMI is. So a BMI of 40 is roughly equivalent to 100 pounds overweight. So let's look what is normal in terms of BMI. A normal BMI is 19 to 25. You're considered overweight if your BMI is 25 to 30. Now, interestingly enough, 70% of America falls into that category and beyond. So only 30% of America technically is considered normal weight. The next level up is obesity. That's the map of the United States I showed you, where now a third of America is considered BMI 30, which is obese and above. There's actually 3 levels of obesity. There's mild obesity, and then there's severe and morbid obesity. Traditionally, as far as operations go, BMI of 35 and above is the requirement to have surgery. Recently, and some of you may have seen in recent news, the FDA is in the process of bringing that number down to 30 for the gastric band operation. We'll talk about the operation so you understand a little bit. It's a less involved operation, but the BMI can be 30 and above in some operations. Okay, so let's look at the BMI range for just 1 second and talk about that. So we're reducing the size of the stomach, which allows for a normal portion of food to come in. If we compare obesity as a disease, which it is, because those factors, satiety, the main one, appetite and metabolism, are controlled with a lot of genetics being involved. So as you have mild obesity or even just overweight, those factors aren't so strong to where diet and exercise may be effective. You may be able to keep 15, 20 pounds off. Most of you know, and through talking with friends and whatnot, that even maintaining a weight loss of 15, 20 pounds is very difficult. So when you get to the more severe forms of obesity, where somebody is 80, 90, 100 or more pounds overweight, keeping that off and maintaining that is very difficult, if not impossible. Most of you have dealt with dieting, and losing the weight is not the issue. Losing the weight can be achieved. Maintaining it is what is nearly impossible, though. So if we look at obesity as a disease, if we compare it to a disease which a lot of you are more familiar with, diabetes, very similar in some respects as far as what's required to control it. We have medications and all sorts of things for high blood pressure, diabetes, high cholesterol, cardiac risk factors, all sorts of things. Very ineffective treatments for severe obesity with medicines alone. The most effective treatment for obesity has been surgery. Since 1991, there was a consensus conference by the National Institutes of Health, and they concluded that surgery is the only effective treatment for long-term severe obesity. They reconvened in 2005, nothing's changed. An operation is still the most effective treatment long-term for severe obesity. So if we look at comparing obesity to diabetes, on the mild end of obesity, like diabetes, it can be controlled with just diet. Just you got to watch what you eat, whether it's controlling your sugar or whether it's controlling your weight. As you progress through the stages of obesity, however, you start to require medications for those forms of diabetes in that same category. And at the most severe form of diabetes, you are required insulin to control your sugar. If you don't have that outside help, being insulin, to help control your sugar, it's impossible to control the sugar. Very similar to obesity. When we get to that level of obesity, severe and morbid obesity, without some outside help, and that outside help is reduction of stomach size to allow for a normal portion of food to be eaten, it is nearly impossible to control your weight. Most of you know that. Most of you have dieted and lost the weight, but there's a greater than 95% failure rate, meaning that you gain the weight back within 1 to 2 years with just obesity. That number goes up to 99% and higher with severe obesity. So that's something that is not new to the people who are considering an operation for surgery. The operations, and we'll go over the numbers and the success of the operation in a few minutes, but that currently is the only effective long-term treatment for obesity, severe obesity, excuse me. Okay, so as physicians, we tend to focus on what obesity causes. And a lot of times we look at medical problems, and those are very important. We're going to talk about those. But there's another side to it that most of you have dealt with for your entire life. That's what we call quality of life, or the non-medical problems. Psychological issues, all sorts of discriminations, and physical limitations. I showed you a map of the United States where nearly a third of America is now considered obese, yet we don't accommodate that at all as a society. Whether it's airplane seats, bus seats, theater seats, whatever it may be, we don't accommodate that. Along those same lines, discrimination, in my opinion, airlines can actually charge double for someone to have to buy 2 seats, to fly on an airplane that's part of the United States, and the citizen of the United States has to pay for 2 seats instead of having a seat that is more normal size, because they're even small for a normal sized person. But that's something that most of you have dealt with for your entire life. When we look over at the other side of it, which are the medical problems, obesity affects our bodies in a very negative way from head to toe. It affects in a negative way nearly every organ system in the body. If I start at the head, there's a condition called pseudotumor cerebri, where you have increased incidence of headaches with obesity. Down into the head and neck, a condition called sleep apnea, because of all the soft tissue in the back of the throat, which causes a lot of problems just by itself, a lot of oxygenation problems. Down into the chest, a condition called hypoventilation syndrome. That's where your lungs don't expand to get the oxygen that's adequate for you. And the reason for that is in obesity, your abdominal cavity takes up half your chest cavity. Our lungs are little sponges. They can only expand in the space they have. They can't push things out of the way. So in a normal weight individual, the lungs are expanding like this. In somebody who's severely obese, they only have the space to expand like this. So that causes oxygen problems. Also in the chest, high blood pressure, which leads to heart attack and strokes. Down lower into the abdomen, acid reflux or GERD, or a lot of you have that, heartburn. Over long periods of time, that can cause some types of cancer. Liver problem, a fatty liver, or what's technical term is non-alcoholic steatohepatitis, but over time the fat deposits take over the normal liver tissue. Gallbladder problems, gallstones. Down lower into the pelvis in women, infertility, because fat tissue causes an imbalance in the female hormones, so the menstrual cycle is not running properly, so they can't become pregnant. They've tried for years and can't become pregnant. A lot of times that's because of weight. Urinary bladder, a condition called urinary stress incontinence, where the abdominal pressure overrides the urinary bladder pressure, so if you laugh or cough, you leak urine. That's a condition called urinary stress incontinence. If we go out into the extremities, increased swelling in the lower extremities because the fluid can't get back up to the heart, so that's over time, your legs have swelling and the swelling doesn't go down. The joints, which is pretty straightforward, but arthritis and the symptoms of arthritis because of the weight on the weight-bearing joints. And then things we don't even think about, but our skin is an organ as well. Increased incidence of rashes and infections in the skin folds because of the heat and moisture. So what this does, and this is why obesity is such a severe problem, because it causes so many medical problems just by itself. Unlike high blood pressure does not cause diabetes and a bunch of other things. It's high blood pressure. Diabetes is diabetes. Sleep apnea is sleep apnea. Obesity causes diabetes, it causes high blood pressure, it causes sleep apnea, it causes problems with triglycerides and cholesterol and cardiac risk factors. It causes all these different kinds of problems. So if we can control the one cause, which is the weight and the obesity, then we have the potential to get rid of all those medical problems, because that's what's causing those medical problems. So obesity is very bad disease because it causes many diseases on top of it being a disease by itself. So we're going to talk about the importance of that and the results of losing weight and the operations in just a few minutes. So again, I mentioned earlier, weight loss is usually not the problem. You can diet and exercise and you can lose weight, but greater than 95% of people will gain that weight back within 1 to 2 years. And again, surgery is the only effective long-term treatment, and we'll discuss the results and the numbers of surgery after we talk about the operations.